For the second time in 7 years, the U.S. Preventative Services Task Force says there is not enough evidence showing that regular skin cancer screenings are beneficial. So the panel of experts declined once again to recommend that everyone be screened. Many disagree with the findings, including my next guest, Dr. Khorasani, Chief of Reconstructive and Cosmetic Surgery at the Mount Sinai Hospital. Dr. Khorasani, welcome.
Thank you for inviting me. Yeah, I appreciate it.
So tell me, what is the significance of this non-recommendation?
Yeah. So just telling us that there's not enough evidence to support it. And you have to understand that in order to design a study, a randomized control study, to show a significant is almost impossible. So they've gone with based on the available data they have, and they come up, they're not saying it's not helping, but it's saying that there's not enough evidence showing that it should be part of a regular screenings.
So what are they basing this on? What does a screening entail?
Yeah. So one of the studies I mentioned in the JAMA article is a study that was done in Germany, fairly homogeneous population, so that's part of the reasons they picked it. Unfortunately, the study had a couple of flaws. First of all, the majority of the people that were screened were women, about 75%. Furthermore, they also lost about close to 40% to follow-up. And they only screened about 20% of the population. Now, they actually did see that there was a decrease in the rate of mortality of melanoma, but they really focused too much on melanoma. And they said in order to save one person from melanoma death, you have to, screen like 100,000 people. So they felt like it was not economical.
I mean, but isn't there some truth there? Because it's such a small percentage of skin cancers that are melanoma, which is the more fatal form of skin cancer. The basal cell and squamous cell carcinomas are not likely to cause death, so they're thinking, well,
exactly.
Why should we have people go through these unnecessary checks, and then they get, scars from skin being removed?
Yep. Excellent question. So melanoma is the most deadly form. Is one of the least common one. Non-melanoma cancers are way more common. They're usually about 99% of them. So there is actually significant mortality and morbidity also from non-melanoma skin cancers. And particular squamous cell carcinoma can cause death, and basal cell carcinoma can be really locally destructive. So what they failed to really put in, look at it under the microscope and see, how many of these people who had screenings with a non-melanoma that were picked up really early, how many of them did we save from becoming disfigured? So that's one of the important issues that they actually didn't address. They really focused solely on melanoma.
Do you believe that there should be annual screenings?
Absolutely, there should be an annual
for everyone.
Screening. That's a very good question. So in the U.S., we are a very heterogeneous population. So I think it should be specific for specific skin types. And in dermatology, we talk about skin type 1, 2, and 3. So 1 is the patients that are very fair skin, redhead, freckles, they always burn. 3 are the patients that die tan easily, but they're all still Caucasian. And a 2 is somewhere in the middle. And I do think that in that population group, you absolutely should get screening annually. And if you have a history of either melanoma or skin cancer, or what we call the atypical nevi or dysplastic nevi, you should definitely get screened. Or if you just have a lot of moles, so if you have over 100 moles in your body, you should definitely have it screened as well.
What about for folks with darker skin tones, black, Southeast Asian? They may not be very likely to go voluntarily to a dermatologist, but having skin cancer is not completely uncommon among those groups of people. So what should the recommendation be for them?
Yeah, very good question. So you can definitely get skin cancer, also African American and darker skin individuals. And I think for them is most important thing is education.
Talk about some of the things people should look for.
So we talk about A, B, C, these are melanoma. So A stands for asymmetry. Your mole needs to, one side needs to match the other. B stands for border, making sure that the border of the mole is is not irregular. C stands for color, making sure there's a uniform color throughout the mole. these for diameter. Anything larger than your pinky usually needs to be addressed. And
Larger than the tip of your
tip
pinky.
of your pinky, exactly. Yeah.
Okay.
And then most important probably is E, and that's evolving. So that will be someone like in a African American patient. They got something on the bottom of their foot. They thought it was a splinter, but it's just not going away. They thought it was a bruise. It's not going away. It's kind of growing. That's a time that definitely need to see their dermatologist.
Okay. And obviously, this time of the year when the sun is hot, people can just protect themselves by wearing sunscreen, wearing long sleeves. We're telling people to do that to prevent against Zika if they travel to certain places.
Exactly.
But, yeah.
So even if it's not sunny outside, you can still have radiation affecting your skin. So like you mentioned, sunscreen, protective clothing. One can try to avoid sun the time that sun UV index is really high. So that's usually between like 10 a.m. to 2 p.m. And try to be smart about it, using sunscreen and using hats and anything that can protect your skin. And no matter if you're type 1 or type 4, you still can get harm from the radiation. And most important thing is aging. Women, that's one single most important factor that ages our skin on the face is actually UV radiation. Yeah. So even African American, they are very concerned with aging because that's half of my business, and I know that that's it's a very concern. No matter what ethnicity you have, aging is a big problem. So sunscreen definitely helps preventing you from aging.
Okay, well that's a good tip. Thank you so much, Dr. Khorasani.
Yeah,
that's all
of
we
course.
have, the time we have right now.
Yeah, you're welcome.